Assalamu alaikum doctors, welcome to my YouTube channel MBBS and BDS lectures. Today is the sixth video of repeat revision course of community dentistry, which is very important for NLE, MDS, NBD as well as for BDS students. And this topic is also important in orthodontics because in previous NLE exam many MCQs of ortho was come from space maintainers and mostly from distal shoe, lower lingual arch, nance palatal arch, bend and loop. Now, we will discuss all in detail. First, how we define space maintainers? These are the devices used to maintain space created by premature loss of deciduous teeth. If deciduous teeth is prematurely lost, to maintain the space, we use space maintainer. Now come to the classification according to Hitchcock. There are five type of classification. Number one, the removable or fixed or semi-fixed. Second, with bend or without bend, with molar bend. Third is the functional or non-functional. Fourth is the active, which apply force, and next is passive, which do not apply force. Fifth is a certain combination of the above, mean combination of the above four types. Now come to the requirement of space maintainers. There are 8 requirements. They should maintain the entire mesiodistal space created by a lost tooth. It should restore the function as far as possible and prevent over-eruption of the buzzing tooth. It must be simple in construction. It should be strong enough to withstand the functional process. It should not exert excessive stresses on joining teeth. It must permit maintenance of oral hygiene. It must not restrict normal growth and development and natural adjustments which take place during the transition from deciduous to permanent teeth. The space maintenance should not come in the way of other function. Now the commonly used space maintainers are of we will discuss in detail commonly used removable space maintainer and fixed space maintainer. There are 3 types of commonly used removable space maintainer. First is the acrylic partial denture. They are used successfully when there are multiple loss of teeth. They are readily adjusted to allow the eruption of the teeth. Teeth are included to restore masticatory function. Clasp are used for this rotation. Mean here when we use acrylic partial denture, when multiple loss of teeth of the patient, then we use acrylic partial denture for patient aesthetic, and they easily allow the eruption of the permanent teeth, and they restore masticatory function, and for retention clasp are used. Second is the complete denture. Complete denture is used when in child patient when all teeth are indicated for extraction due to rampant caries in preschool child. Due to rampant caries, all teeth are involved, and there is requirement. If there is requirement to for extraction of all teeth, then we give complete denture. These denture restore both masticatory function and aesthetic. They also guide first permanent molar into their correct function as posterior border are placed over the area approximating the mesial surface of unerupted first premolar. A portion of denture is cut to allow the permanent incisor to erupt. When molar and incisor erupt, then we give a partial denture. Third is the removable distal shoe space maintainer. It is an immediate acrylic partial denture with acrylic distal shoe extension. It is used to guide the first permanent molar into position when deciduous second molar is lost shortly before the eruption of the first molar. Mean first molar is not erupt still, but second primary molar is prematurely lost, and the first permanent molar when come they will move mesially. Then we give removable distal shoe space maintainer. These are the commonly used removable space maintainer. Now come to the fixed space maintainer. In few commonly used fixed space maintainer are: first is the bend and loop. In bend and loop, we give bend on molar and we extend the loop in incisal region. In bend and loop, bend and loop are given in a unilateral. It is given as a unilateral fixed space maintainer to maintain space in posterior segment. Remember, to maintain space in posterior segment when a single tooth is lost. Bend and loop is a unilateral space maintainer. Here we give bend on tooth, and it is first important thing is it is a unilateral fixed spacement error. Second is it is indicated to maintain a space in posterior region, and when a single tooth is lost, remember, tooth distal to the space, tooth distal to the space is bended. On that tooth we apply bend, and a thick stainless steel wire is soldered to it. With that bend we weld or solder the stainless steel thick wire it with its mesial end, touching the tooth mesial to the space. Mean now like if there is a mean if primary canine is lost, if primary first molar is lost, then we apply bend on second primary molar, and we solder the wire with it bend and move the wire toward the canine. This is the bend and loop. Now when premature loss of E occur, means second molar occur when first molar is erupt, then we give bend and loop. If first molar is not erupt, then we give distal shoe, remember. Second is the crown and loop. Here same, it is similar to bend and loop. Instead of bend we give crown. Same like here, we apply bend on the tooth to cover the tooth by bend, and here crown and loop. Instead of bend we give crown and then attach loop up wire, and it is given in the tooth. It is similar to the bend and loop, except instead of bend, crown is given in cases when abutment tooth is highly carious, mark hypoplasia, or pulpotomized. Third is the lingual arch. It is the most effective appliance. Remember, it is the most effective appliance for space maintenance in the lower arch. Lingual arch means lingual tongue is present, therefore its name is lingual arch, and it is used only in lower arch. It is indicated when there are bilateral multiple loss of primary molar. If there is a bilateral multiple loss of primary molar, remember bend and loop are unilateral, but lingual arch if bilateral loss of teeth. It is indicated when there are bilateral multiple loss of teeth, but bend and loop is a single teeth. It helps in maintaining the arch perimeter by preventing both mesial drifting of the molar and also lingual collapse of the anterior teeth. Bend are cemented on first permanent molar or on the second deciduous molar and joined by stainless steel wire contacting the lingual surfaces of the four mandibular incisors. Now come to the palatal arches, and this is only used in a palate, also known as Nance palatal arch. It is similar to the lingual arch, but wire does not contact maxillary incisor. In lingual arch, the arch contacts the interior mandibular four incisor, but in palatal arch, it does not contact the maxillary arch, and next is same. It incorporates an acrylic button in the anterior region that contact the palatal tissue. Here they do not contact the maxillary incisor. Instead of that, there is an acrylic button in the anterior region that contact the palatal tissue. It is designed to prevent mesial migration of the maxillary molar. Next is the fifth is the transpalatal arch. It has been recommended for stabilizing the maxillary first permanent molar when primary molar require extraction. A best example is when one side of the arch is intact and multiple primary teeth on the other side are missing. One side is intact and the other side is multiple teeth missing. Then we give transpalatal arch in maxilla. It consists of thick stainless steel wire that span the palate and cross the palate, connecting the first premolar of one side with other side. Sixth is the distal shoe spacement error. Very, very important. It is also called intraalveolar appliance because they are given inside the socket. It is indicated when primary second molar are extracted prior to the eruption of the permanent molar. First permanent molar is not erupt. If E is lost prematurely, mean second deciduous molar, if lost prematurely, If first molar is erupt, then we give bend and loop. If first molar is not erupt, to guide its eruption, then we give a distal shoe space maintainer. Bend is placed over deciduous first molar or canine and horizontal bar is soldered to the bend. The vertical component here, the bend is placed on deciduous first molar because deciduous second molar is lost. And also we can place bend on canine and the horizontal bar is soldered to the bend. The vertical component of the bar intragingival extraction inside the gingiva is placed in the bone mesial to the permanent first molar. Depth of the bone is calculated by radiograph. The vertical component guide the first permanent molar to erupt into its position but do not move mesially. Seventh is the bend and bar are crown and bar. Similar to the bend and loop and crown and loop, instead of using loop, a bar is used to connect the abutment teeth and either side of the extraction space. This is all about space maintainer, which is important in ortho as well as for community dentistry. Now today our topic is complete. If you like my video, press the like button and share this video with your friends. If you are new to my channel, subscribe my channel by pressing the red subscribe button and also press the bell icon in order to receive my each new video notification. For watching my videos, I am very thankful to you. Thank you very much.